if you're flirting with keto and you're still flirting with my scrambled eggs that turn into a chocolate mousse, for some people, and I've got a client, I've got this woman, 72 years old, met her last May. In the first 6 weeks, she was walking with canes when I met her and hunched over. Within 6 weeks, 6 to 8 weeks, she's walking straight up without canes, looking like a 16-year-old kid walking down the sidewalk. We were in the car sitting together. She goes, look, watch this, Brett. She gets out and she's like walking down the sidewalk. She jumps back in the car and she goes, what do you think? I go, I'm not sure what you wanted me to see there, but you looked really happy. She goes, you remember I used to walk with canes? I'm walking like I'm a kid again with no pain. All 20 years of arthritic pain that her doctors couldn't do anything with evaporated in under 2 months.
On what diet?
Well,
simple.
I never used the words carnivore with her. I taught her the realities. And our first thing that we did together is we went to Costco and we read labels and I explained, here's what you can start with and get to. Within that period of time, she was 90% carnivore. Okay.
Which is high fat meat is carnivore.
Yes, absolutely.
And so significantly reduced plants.
Oh, yeah. Plants were almost completely gone. I don't tell her that she couldn't eat a little broccoli or asparagus if she wanted to. But she knew I was just coming into my 4 month of going full on carnivore, even without coffee, because she had so much brain fog. I gave her one of my, like a 68-page guide that I have. And she goes, Brett, I can't read 3 paragraphs because I have so much brain fog. I can't concentrate. So we had to talk through all of this education instead of reading it. So after 2 months and off of, all the arthritis gone that doctors couldn't do anything about for 20 years, she had spent 30 years on SSRIs. She started with her doctor weaning off of that and got off of all of her SSRI. She, just before I met her, dropped 80 pounds using Wegovy and Ozempic, like GLP-1 agonists. And I go, I understand that. And she goes, but then but I had to quit it because my insurance stopped paying for it and it stopped working for me. I go, there's other side effects. I'm glad you quit it. She goes, but then I put 20 pounds on in 3 weeks when I went off of it. I go, that happens to everybody if you don't learn how to eat first. And she goes, so I had to go back on it so I didn't regain everything again. And she, in that 2-3 month period of time, she re-lost the 20 pounds she put back on 4 months before meeting me when she came off of the Wegovy. And she got herself off the Wegovy and kept losing and never regained again because she now understands proper human nutrition.
On the Wegovy and her standard diet of losing weight, did she lose her symptoms?
Oh, never once. Nothing helped.
Good.
She's still walking with canes. She still had the SSRI and all the brain fog.
It's not the weight. It's the poisonous plants that are inside our gut, which then circulate throughout. We have poison ivy. And so there's no poison ivy disease, is there? It's only exposure to poisons. Plants are the exposure to the poisons that cause every disease that we label as all these diseases, which they're not. They're symptoms, as you described, and it sounds like your keto / carnivore was really a game changer.
Oh, absolutely.